Heartburn banned meatballs and red sauce from Connie Stancil's menu until recently. She had difficulty eating most anything without paying a painful price.
Early '06, I started having a lot of heartburn and indigestion. It seemed just kind of hard for me to eat certain foods, and every time I ate them, they would give me a lot of problems as far as the burning in my chest or in my throat.
The problem progressed, making it hard for this church pastor to speak.
I would get hoarse, and it was at times that I could barely talk, and sometimes that hoarseness would last up to 2 to 3 weeks.
Reflux interfered with her sleep.
A lot of nights I would just kind of sit up on the couch because sometimes it felt like I was regurgitating. Most nights I really didn't get a lot of sleep, so it left me the next morning I would be tired.
She tried over-the-counter remedies.
Tums and Rolaids and things like that, but it just didn't really do the trick.
Then graduated to prescription medications.
They weren't working either.
She'd almost given up until a TV show caught her eye, Rex on Call.
It was on a Saturday evening. Really just kind of concerned about the condition and honestly praying, trying to figure out what am I going to do next. That Saturday night I was kind of flipping on the television, and I saw there was a doctor, Dr. Draglin, was talking about a particular surgery. He was talking about heartburn. Thought to myself, I'm experiencing all of these things. I really kind of ran to get my husband, and I began to tell him, they're talking about this and this sounds just like me, So of course he was like, you need to call, because there was a number, saying you could call in, and if you had questions, you could ask questions and things like that. So I did call.
Rush me.
Heartburn Center.
Connie requested a callback from the Rex Heartburn Center, a unique center with swift action.
When I went in to see Dr. Draglin, he set me up with a couple of tests.
Tests include upper endoscopy to rule out pathology such as cancer, pH impedance to determine if it's acid or non-acid reflux, and manometry to measure how well the esophagus works.
We pretty much see them, set a plan, get the information back, and then definitive care. At each step, immediately when there's either an improvement or a failure at that step, we move right on to the next step.
Unlike any heartburn program in the nation, the Rex Heartburn Center uses a multidisciplinary approach with a team of surgeons, gastroenterologists, pulmonologists, and cardiologists.
Multiple specialties all coming together kind of with the same goal in mind, which is to take the heartburn patient and provide them with expert care.
The care and cure for Connie? Surgery. Her results, she says, were immediate.
I don't have that same hoarseness. I have more energy because I am resting better. It's great to be able to eat what I want.
Definitely she's had an excellent outcome.